As we move forward from the intrinsic system, we'll go into the outer unit systems, which in this particular slide we're looking at is the posterior oblique system. We talk about the intrinsic systems are basically supporting the ability for the outer unit systems or the posterior oblique system to function properly. So if the transversus, if the diaphragm, if the pelvic floor multifidus aren't working properly, the compensation will be overcompensating within these outer unit muscles. So if we talk about the gait, when one leg goes forward and the opposite arm goes forward, it creates this energy throughout through the thoracolumbar fascia. And when the opposite leg moves forward into the ground, the reaction forces send the energy up through the body into the SI joint, which compresses and causes form closure. And then that energy releases, creating what we call the smart spring of Margaria. And this is when the body's stress energy releases by way of ambulation. So it basically holds energy and releases energy by way of the sling. What sling? In this particular slide, it's the posterior oblique sling. So another potential opportunity when we talk about gait is if there is a particular lack of range of motion that you would see in one hip as you're analyzing the gait pattern, as you're watching the translation within the spine, as you're watching the opposite arm move through its range of motion. If you see that there is lack of range of motion in the hip, if it's not figured out, if it's not rehabbed, then research shows that within 1 to 5 years, there will be a restriction that will mimic in that opposite shoulder. So, as we talk about the gait pattern, we're talking about the posterior oblique system. I want you to consider, it doesn't exactly show it on the slide, so let me point it out. I want you to consider the left gluteus moves through the thoracolumbar fascia, through the lat, all the way to the shoulder. So these are working systems that mimic each other if one has dysfunction in it. So what I just said, if there's an opposite hip issue and it has a restricted range of motion for some reason, then you also see this shoulder shorten its range of motion within the swing of gait. So as a practitioner, if you do notice that, then one of the things that you need to do is you need to look at what's causing the restriction in the hip and the shoulder and which one came first. That would all depend on the activity previous with the client that came in, because it could have happened in the shoulder first and then caused the hip, or it could have happened initially within the hip that caused the shoulder restriction. Functional anatomy of the butt. Did you know that the butt is also the back? Now, we have talked, I said it really quick, but we talked about the lower back embryologically connected to the lower abdominals. They are of the same tissues, of the same making at the same time. So the lat links the upper body with the lower body through the thoracolumbar fascia to the glute. When then it attaches to the IT and femur, ultimately it is to really stabilize the knee. So what I just said is, if somebody has knee problems, is it the knee? Well, we wouldn't be rehabbing the knee and working on all of that. We could look to the femur, IT, and the glute, and the lat as the responsibility of potentially causing the destabilization of the knee, which would ultimately cause pain or torsion. Okay, so if everything is working correctly, then there should be no trauma also to the spine, because when the lat through the thoracolumbar fascia to the glute, running down the IT to the knee, if that's all working functionally, then with movement or translation in gait, the spine just floats and does what it's supposed to. And these muscles are responsible for taking the loads and the decompression that happens with running or jogging or walking for that matter. So in rehab, we would train them integratively. In other words, you would start by isolating, what's going on with the glute complex as it relates to the SI joint. Real important, because we need that form force closure for those guys to work properly when ambulating. And the responsibility of the form force closure comes by way of the stabilization system. If the stabilization system is working appropriately, there's form force closure, and it allows the integrative or the outer unit or the back, the lats, the glutes, the thoracolumbar fascia, the oblique, posterior oblique system to work properly. So if there's a spinal issue or a back problem, what I just told you is posterior oblique system and the glutes and the lats are all very important to address to see if they're working like they should, and if they're not, the compensation that you see would ultimately lead you to deeper intrinsic system. And if the intrinsic system or stabilization mechanism that we talked about, if it's not working properly, then you would go deeper to that. What's deeper to the musculoskeletal system? Organs and glands, okay? And then you would look to any type of inflammation or disruption within the organs and glands, i.e. what they're eating that could potentially cause this inflammation. So if there is low back, if there is issues with the glutes, if there is destabilization of the SI joint, if there is torsion within the pelvis that could potentially cause a scoliosis, it all could be caused by organ and gland inflammation by what somebody's eating. So it's important that we address and use our HAQs to determine what someone's eating. This is a CHEK practitioner using the holistic integrated system to approach somebody's pain. Oh, so here we have another outer unit system that is supported by our intrinsic system. I'm gonna have to keep saying that because oftentimes we forget that. So the lateral system is the QLO that crosses over the SI joint to the glute med, and on that same side, the adductors. So women, because of their QL angle, oftentimes end up getting some sort of pain. And think about where that pain could be coming from. If the QL angle, let's talk about what the QL angle means, meaning they have larger hips. And when a female has larger hips, the QL angle is larger. And when they do, let's take an example that's on the slide, when they do like step-ups and they've lost the function of this lateral system, the hip kind of goes out and moves into the frontal plane, which causes dysfunction. This particular dysfunction can lead to we would call it a syndrome, and it's called lateral patellar syndrome, which says that it's the patella that's tracking lateral when really it's the lack of stabilization support for the lateral system. So the glute, remember, so it attaches to the femur, which is an external rotator that should pull the femur in line with the patella, but instead the femur falls medially and rotates, and the patella goes lateral and the femur goes medial, and long term shows up as a pronation issue and pelvic torsion, SI joints, sciatica, all shown on this slide when someone steps up. One of the things that we can do as a practitioner to assess if this is potentially happening is we can draw a line on the very middle of the patella. And then we can also draw a line on the second toe from the big toe. And then when someone steps up, we should be able to see that the line on the knee track directly over the second toe where the second line is drawn. And that's the subtalar axis and a field of gravity that is optimal for not having issues within the lateral system of the body. So another issue that you can quite possibly see when this lateral system isn't working functionally by way of potentially an intrinsic system that's faulty is it'll show up as a Trendelenburg in the gait pattern. And that's essentially when somebody's walking, the hip falls out and the head doesn't line up with the pelvis. And then if it goes on for a period of time, a long period of time, then oftentimes it'll move into a compensated Trendelenburg, where the head then pulls, well, has to, eventually wants to, make sure that the head is in line with the pelvis. That still is not supported in the frontal plane. So ultimately that will lead to, obviously, you see the compensation that happens in the spine. Okay, so transverse system. This next system, we've already said that the glute is responsible for externally rotating. So it's a rotary muscle, yes. If the right arm is pushing and the right glute is externally rotating in a closed chain, as you can see depicted in the single arm cable push here. In other words, if you're looking, if you're on a path of isolation and now you're moving into integration, we talked about we have to train the system integratively to fully come to a rehab position for an individual to be functional. So we would train the lats through the thoracolumbar fascia to the glutes. Now, that's important to do integratively, and it's also important to do with single arm adding the twist version, because oftentimes we can do two arm pulls, we can do two arm pulls in a lunge with a anterior posterior translation, but we eventually then need to add the twist back into it. That's important because, remember, twist is the catalyst to all primal patterns. So the glutes are responsible for contributing this force generation from the hand, as you can see in the single arm push pattern. But if the inner unit is not firing appropriately, then we can potentially overuse joint systems and create a faulty motor program that results with pain in the, what would be the compensation? Well, within the twist, the facets would get inflamed, the shoulder, and we would also see a tremendous amount of overuse in the lumbopelvic area. So in the transverse plane, the lumbar really isn't responsible for rotation. The thoracic is. The thoracic gets predominantly 30 to 50 degrees of rotation, but the lumbar is not set for rotation. It's responsible for only 3 to 18 degrees of rotation. So if there's restriction in the transverse plane, that lumbar will be forced to do more to complete the exercise or / movement, i.e., where would that power movement predominantly come from in our daily activities? Golf, and that's a very common injury within golfers.